Pathophysiology, as with any new subject, there is always going to be terminology associated with it. It's like learning another language. It really is learning another language. A lot of medical terminology is based on Latin and Greek. And as we go through and learn about different systems of the body, I will try to dissect the words down for you so we understand what we're talking about and what things mean, and you have a good understanding and can communicate with other healthcare professionals. So there are a lot of body systems that are dependent on each other. And really, it's not, we talk about things, we divide it into different organ systems and different functional systems, but really it is all functioning as one organism. So it's fascinating, but we need the terminology to be able to study it. So for the learning objectives, I want you to be able to define the basic terminology that I discuss in this lecture, list the different types of disease manifestations, and we'll talk about what manifestations are, the terms of epidemiology, differentiating between acute and chronic disease, and contrasting those. How would you decide if a patient you were treating had acute or chronic symptoms? Let's talk about it. So usually when we are talking about a disease or an abnormal condition, it involves changes at the organ or system level, which we refer to as the gross level. But there are also changes at the cellular level, which is the microscopic level. In pathophysiology, a lot of times we are talking about the effects of abnormalities at the organ level, but you have to understand the cellular changes to fully understand the effects. So we'll talk about, at the end of this chapter, we'll talk about different cellular changes. The lots of different cellular studies that go on with living tissue. One of them is, I mean, the idea of when we do cellular studies of living tissue is to establish the cause of a disease. So a biopsy is an excision of a small amount of living tissue, and then that specimen is usually examined under a microscope. An autopsy is the examination after death. So a lot of times with an autopsy, there is a medical autopsy where they're trying to determine the cause of death. And then there's a forensic autopsy, which is the kind you see on, you know, cop shows on TV, where they're trying to figure out the legal aspects of the cause of death. A lot of things can be learned from an autopsy. They're not going to help the individual whose body's being examined, but they might help somebody else in the future. So that's a big difference between a biopsy and an autopsy. There are a few terms that are frequently used in the discussion of disease processes. So a diagnosis refers to the identification of a basic disease. So whoever is doing the diagnosis, usually the physician or nurse practitioner or physical therapist, is going to evaluate the signs and symptoms. They might look at laboratory tests and imaging. They're trying to verify that what they think the person has is what they really have. So, for example, like the diagnosis of a particular disease might involve certain laboratory tests. For to be diagnosed as having type 2 diabetes or type 1 diabetes, you have to, there are certain laboratory tests they look at. So when we look at different systems, we'll talk about what diagnostic tests are used to determine particular disease processes. Etiology is causative factors for a particular disease. Like, what caused it? How did you get this disease? Sometimes you don't know, but sometimes you do know. And so the different types of causative factors for diseases include congenital defects, inherited or genetic disorders, microorganisms like bacteria and viruses, immunological dysfunctions, degenerative changes. Arthritis is a good example of degenerative changes, or degenerative disc disease, malignancies, which are tumors, metabolic or nutritional problems, and trauma, burns, or environmental factors. So lots of different things could cause disease, and part of the process of diagnosis is figuring out what caused the disease. So when they just plain old don't know, it's called idiopathic. And one of the PTs that I used to work with, she said idiopathic, she remembered it as idiot pathology. The idiots don't know what causes it. So idiopathic means, okay, you have this disease, we can diagnose that you have this disease, but we don't know what causes it. So there are some well-known diseases that at current time we don't know the cause of it. Parkinson's disease is a good example of that. It's idiopathic. There are definitely factors that may contribute, but strictly speaking, they don't know what causes it. And iatrogenic disease is something that's caused by a treatment or procedure or even a medical error that causes the disease. So an example of this is like you take a medication to treat one thing and it affects another system. So when you read the warnings on medications, a lot of times they say may cause this other problem. So that's considered, the other problem would be considered an iatrogenic disease. Or if the surgeon took out the wrong part, or when, say, they're removing part of your thyroid because you have a tumor, and the parathyroid is tiny, tiny, and it's right on the thyroid. And so you end up with parathyroid deficiencies because that got taken out as part of the procedure, just because it's pretty hard to separate that out. Another good example is a lot of times when they're doing surgery for head and neck cancer, they end up nicking the long thoracic nerve. And if you recall from kinesiology, the long thoracic nerve innervates the serratus anterior, which is responsible for scapular protraction and scapular upward rotation. So it's going to affect your shoulder function, and it's iatrogenic. It's caused by another procedure. So a lot of medical treatments have potential complications that go with them, and those can cause iatrogenic problems. Predisposing factors are things that you have that might predispose you to disease. So they're considered tendencies to promote the development of a disease. It indicates a high risk for the disease, but it doesn't mean that you're gonna get something. So age can be a predisposing factor, gender, inherited factors, genetic factors, environment. So if you, like, say that you have a job that you work outside all the time, that could be a predisposing factor for skin cancer. So predisposing factor means that it increases your risk for the disease. It doesn't necessarily cause the disease. Prophylaxis is something that's used to preserve health or prevent the spread of disease. So a prophylactic measure is whether it's used by an individual or, the whole community, whatever. We're trying to prevent the spread of disease. So it's like when your doctor says, okay, you have a history of heart disease in your family and you have some other risk factors. I'm going to have you take a baby aspirin every day to thin your blood a little bit, just to help avoid cardiovascular disease in the future. That's one idea of a prophylactic measure. Prevention includes all the things we said in the 7 steps for health. So vaccinations, dietary and lifestyle modifications, like wearing a helmet when you go skydiving, prevention of potentially harmful activities. So just the anything that can help prevent you ending up with a trauma or disease. So when we describe the characteristics of a particular disease, there are a lot of standard terms with this too. Pathogenesis is the development of the disease. It's the sequence of events involved in the tissue changes that are related to specific disease processes. The onset of the disease, it may be sudden and obvious, which is acute, Or it may be insidious, gradual, with vague or mild signs over time. So the a lot of times diseases with an insidious onset are a little bit harder to detect because you don't notice it. There might be several stages in the development of a single disease. So there are diseases that are only acute, there are ones that are only chronic, there are ones that have acute and chronic phases. And so it's all mixed up in there. So acute disease is usually short term and develops quickly. Signs of acute disease might include like a high fever or severe pain. Chronic disease tends to develop gradually, and the symptoms are generally milder and often intermittent. And you might have acute episodes with chronic disease. So a lot of times you'll have something like fibromyalgia is a good example of a chronic disease with usually insidious onset, develops gradually. You might have acute exacerbations where you have severe pain or you have days where you can't do anything, and then days when you have milder symptoms. So that's a good example of chronic disease with intermittent acute episodes. So the subclinical state exists in some conditions where pathological changes have started, but there are no obvious manifestations yet. So a lot of times the disease agent is, the disease agent is a microorganism like a bacterium, there is an incubation period where the bacteria have to form colonies before they start um, really wreaking havoc on your body. And so there are pathological changes going on. You've got the infection, but there are no obvious manifestations yet. However, with infectious diseases, you might be infectious in the subclinical state. You might be able to pass that disease on to somebody else. And we'll talk more about that in chapter 6. The latent state of a disease is there no symptoms or clinical signs evident. It might be the incubation period of an infectious disease. It might be a latent state of an infectious disease. There are certain bacteria that can exist in a latent state and then show up later, just to make it interesting. Shingles is a good example. There's once you get chickenpox, varicella zoster when you're a kid, you recover from it, hopefully, and the virus still exists in your body in a latent state, and there's no symptoms or clinical signs evidence. But later on, much later in life, you might end up with shingles, which is the same virus wreaking havoc on your nerves. So it's existed in a latent state in your body. The prodromal period is early in the development of the disease. You might have non-specific or absent signs. It's like you feel like I don't feel sick, but I almost feel like something's coming on, like I'm getting a cold. And it's funny, like a lot of times when I teach pathology class, people will say they learn this terminology and then they say, "Oh, I'm feeling a little prodromal today." So I think we've all had it, like we're starting to feel a little bit icky, but we don't quite feel sick yet. So signs are non-specific or absent. It might be something pretty vague, like fatigue, loss of appetite, headache, and that could be an indication of oncoming disease, or it could just be having a bad day, right? So if you're in the prodromal period, you might be having a bad day or you might be developing a disease. Manifestations are clinical evidence of disease with signs and symptoms. So signs and symptoms, clinical evidence is something you can measure or see or report clinically. Manifestations can be local at the site of a problem, or they can be systemic, like a fever is a systemic manifestation. So local manifestations can be things like redness and swelling at the site of the problem, or fever, malaise, headache, those systemic sort of symptoms. So if once it gets to the point where you can report it or measure it, it's a manifestation. Signs are things you can measure. So I can measure your signs. Symptoms are things that the patient reports. Okay, and symptoms are real. Just because you can't measure them doesn't mean they're not real. But signs you can measure, symptoms you can't. Signs and symptoms together are manifestations. A lot of times when we start to classify diseases, we'll talk about the etiology, the cause, the pathology, what's the cellular change that's happening, the manifestations, the signs and symptoms, and then the diagnosis and the treatment. So all those things we're going to talk about in characterizing diseases. So signs are objective indicators. Objective means you can measure it. Symptoms are subjective feelings. The patient can report to you pain, nausea, headache. You can't measure any of those things, but they're real. Lesions are specific local changes in the tissue. So something has changed in the cells. There is a specific local change. It might be microscopic, or it could be highly visible, like it could be visible on your skin. But a lesion is a change in the cells. A syndrome is a collection of signs and symptoms, often affecting more than one organ system, that occur together in response to a certain condition. So once they start to put together all like, oh, this is happening here, this is happening here, this is happening here, they can start to diagnose a syndrome. Diagnostic tests can be laboratory tests that assist in the diagnosis of a specific disease. Usually, tests are ordered based on the patient's manifestation and medical history, the clinical examination by the healthcare practitioner, and the patient's answers to specific questions. Diagnostic tests can also be used to monitor response to treatment. So it could be chemical analysis of body fluids like blood or tissue samples, or urine. It could be identification of microorganisms in body fluids, so cultures, tissue culture, or cell cultures, and figuring out how we're going to kill those microorganisms. What antibiotics do they respond to? A lot of times we're repeating the test to see, is it getting any better or worse? Hopefully not worse. Um, Remissions and exacerbations. They mark the course or progress of a disease. So a remission is a period in which the manifestations subside. An exacerbation is a worsening of severity. So there are a lot of chronic illnesses such as rheumatoid arthritis, fibromyalgia I mentioned earlier, multiple sclerosis. They're chronic inflammatory diseases with acute exacerbations. So an exacerbation of rheumatoid arthritis might include increased pain, increased swelling, maybe some localized redness and swelling in joints, that sort of thing. An exacerbation of MS might include more difficulty with mobility, challenges with balance, challenges with any kind of function, sometimes changes in vision. And then a remission is a period when the manifestations subside and you feel better, usually. A precipitating factor can be a condition that triggers an acute episode. So a good example with multiple sclerosis is sometimes people, if they're exposed to a lot of heat, that can trigger an acute episode. And so the heat is the precipitating factor. Complications are new or secondary additional problems that result from the disease. So some of the complications for diseases can be complications of immobility that the disease causes. So complications can be, so having the initial disease process causes the secondary or additional problem. And we'll talk about tons of those when we start talking about individual pathologies. Therapy is any measure used to promote recovery or slow the progress of a disease. So it can be like physical therapy, it can be medical therapy, it can be surgical therapy, anything that is any measure that's trying to promote or slow the promote recovery or slow the progress of a disease. Sequelae are potential unwanted outcomes. So, sequelae, it could be like spasticity after you've had a CVA or a stroke. The stroke doesn't always result in spasticity, but it can. And so that's a sequelae of a stroke. Convalescence or rehabilitation is the period of recovery and return to a healthy state. It might last for several days or months. So I have worked with a lot of people with total knee replacements, and their period of recovery is long. Even though after about 6 weeks they usually feel a lot better, but it's going to take them probably a year to get back to normal. And one lady that I worked with for 2 knee replacements and a hip replacement, she told me that really after a year you feel 100% again, and after 2 years you'll forget you even had it. So her convalescence or rehabilitation period for recovery from a total knee replacement was about a year before she felt back to her normal healthy state. So once we start to talk about prognosis, so diagnosis is figuring out what disease you have. Prognosis is the probability or likelihood for recovery or other outcomes. So it's a prediction of your course of the disease, if you want to think of it that way. Often doctors will use probability based on average outcomes. Certainly, there's going to be variables among individuals. One of the things that we find in the rehabilitation world in physical therapy is that people with like a simple orthopedic injury or surgery can have a pretty predictable prognosis, a pretty predictable course of treatment and recovery. Someone with a neurological disease might have a less predictable diagnosis or a more individualized prognosis. So, really, a lot of different statistical things are looked at to determine disease prognosis. Morbidity is the disease rate within a group. So it's sometimes used to indicate the functional impairment that certain conditions such as stroke cause within a population. So a disease with a high morbidity means that it can cause a lot of impairment. Low morbidity means it doesn't cause a lot of impairment. Mortality is the relative number of deaths resulting from the disease. An autopsy, we already talked about, it's the postmortem examination. Epidemiology is the science of tracking the pattern or occurrence of disease. So there are major data collection centers like the World Health Organization and the Centers for Disease Control in the United States that track the transmission and distribution of diseases. So one of the major functions of the World Health Organization and the Centers for Disease Control is to control the spread of infectious diseases. And a lot of times they're looking for patterns and trends that are happening in disease. And they're characterized. So the incidence of a disease is the number of new cases in a given population within a given time period. So if you say a certain number of people were diagnosed with influenza in the last month, that's the incidence of influenza. Prevalence is the number of new, old, or existing cases within a given population and time period. So you can say at this time, X number of people have this disease. So the incidence is the number of new cases, and the prevalence is the number of new, old, or existing cases. So everybody that has it at once. If you have a higher number of expected cases of an infectious disease within an area, that's considered an epidemic. It's a large temporary increase in cases. And now we're all really familiar with the word pandemic because it's been overused past 5 years, 4 years. Um, it's a higher number of infectious diseases in many regions of the globe. So it's like an epidemic all over the world. You want to think of it that way. So it's just a higher number of expected cases of an infectious disease. And pandemic is everywhere. Communicable diseases are infectious diseases that can spread from one person to another. So this picture is a great example of droplet transmission. We'll talk about different types of transmission. But any communicable disease that you can spread from one person to another. Notifiable or reportable diseases are things that have to be reported by the physician or healthcare practitioner to designated authorities. So it's going to vary depending on where you live. So certain states, counties, countries, whatever, have different notifiable or reportable diseases. And the required diseases to be reported may change over time. So 20 years ago, we had to report certain things, and now they're different things. So the reporting is intended to prevent further spread of the disease. So it's a way of individual local or regional authorities to deal with the spread of disease and trying to prevent the spread of disease. So as healthcare practitioners, we will find out when things change, what's notifiable and what's reportable. And that's something you should know for your individual state and region that you're working in.